Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Your dog's mouth is cleaner than yours. A cat will always land on its feet. Indoor pets don't need parasite prevention. These are some common pet myths that folks think are true, but they're really not. Today, we're busting some of the biggest myths in pet healthcare, as well as answering your pet-related health questions on this episode of Ask the Doc, No Appointment Needed. Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Dr. Joy Carter, Doctor of Veterinary Medicine, and today we're going to be focusing on common pet myths. All right, so our first question is going to be from Penn, who reached out through our website, allhealthtv.com. Hey, Dr. Carter, our young daughter Molly heard the myth about cats always landing on their feet and has been experimenting by dropping our cat onto the bed. Would you mind telling our baby girl that it's just not true? All right, Penn, this is a great question to kickstart this particular episode. So typically cats do tend to land on their feet, but that is not always the case, okay? That is certainly a myth, all right? Cats are very agile animals. And so a lot of times, depending on the height or wherever they're dropped from or wherever they fall from, a lot of times they are able to rotate their bodies around and land on their feet. But that is not always the case, okay? So I don't recommend anybody trying that out. Now, unfortunately, there is something called high-rise syndrome in cats. Particularly, you see it in more metropolitan areas, your cities like New York City and even downtown Miami. A lot of people that are living in condos or high-rise buildings, unfortunately, their cat can make it out to their balcony and sometimes accidentally fall off. Typically with high-rise syndrome, it's usually got to be more than a couple of stories. Unfortunately, those pets, a lot of times, or those cats come in and they are in pretty rough shape. They can have fractures. They can have what we call pulmonary contusions, which is kind of bleeding in the lungs. They can also, have what's called a pneumothorax, air in the chest, different things like that. They can have jaw fractures, skull fractures, so many different things. Okay. I actually had a cat that came in this week to my hospital that just fell from one balcony onto another balcony, and it actually fractured what's called its hard palate. So it's a very top part of their mouth. It had a crack in there that it had to repair. Luckily, the cat was fine besides that, but obviously there can be life-threatening injuries. I have certainly seen cats that have fallen. I think the highest I've seen was maybe like 4 or 5 stories. And actually the cat, at least what we saw in physical exam and with diagnostics and radiograph, was otherwise fine. The cat, I think, was just really shook up. But that's the highest. But unfortunately, not all of the cases that I've seen with high-rise syndrome have had a good outcome like that. So don't test this myth. Yes, your cat may land on its feet if you drop it, but that is not always the case. And hopefully your baby girl, Penn, sees this and realizes she should stop trying to do that with her on the bed. All right. Right. Our next question is Renee, who reached out to us through Facebook. Hi, Dr. C. I got a big old goofy golden retriever who thinks his job is to give everyone slobbery kisses. So here's the question. Are dogs' mouth cleaner than ours? All right, Renee. I love Goldens. They are so super cute. And yes, they do sometimes give the best kisses. Okay. So that is a myth too. All right. Just like us, dogs and cats have bacteria in their mouth. Now, most people who do not have a weakened immune system, that bacteria does not cause us problems. But people that are immunocompromised or have a weakened immune system, or someone who maybe has like an open wound, if that bacteria does get in there, it certainly could cause problems. I will say this, I have seen people with dogs who have horrible mouths as far as breath and dental disease and things like that, just give them kisses and lick them all over. That's up to the owners, but definitely dogs with bad periodontal disease are going to have more bacteria in their mouth. And so it technically is more of a danger. It's not really a danger to everyday normal people or even kids. Okay. People that have to be careful about getting licked or getting kissed by a dog or a cat are going to be people that are immunocompromised. So their mouths aren't necessarily any cleaner than ours. They're not necessarily any worse than ours. So just remember this. If you got any type of health condition that affects your immune system, it's better to save those kisses for something else, not with your dog. Okay. All right. We've got another Facebook question from a loyal viewer, and this is from Damon. Dr. Carter, I have a 3-year-old Karen Terrier who's been eating grass lately. Does that mean she's trying to tell us that she's sick? All right, Damien, this is another one of my favorite myths. I hear this quite often. Oh, my dog was eating grass. I think my dog is sick now. Okay. So just because your dog or cat eats grass does not mean that they are sick. All right. Now, do some dogs and cats that are having some gastrointestinal issues eat grass? Yes, they do, but they also will eat grass just to eat it. I've certainly seen dogs eat it. I've seen cats eat it. And then, yes, sometimes they will throw it back up. And other times they don't. Cats like grass. Okay. I would say if you have an indoor cat, there's some things if you want your cat to be able to eat some grass. I think there's actually something called cat grass that you can get and you can like grow, or you can even buy the plant and have it in your house. And that's really good for cats. Also catnip. Every cat that I know of, at least that I've met, loves catnip. And as far as dogs, if you take your dog out for a walk, okay, and they eat a little bit of grass, there's not really anything to be that concerned about unless your dog is having other gastrointestinal signs. So that's going to be things like vomiting, diarrhea, seeming painful in the abdomen, decreased appetite, or no appetite at all. If you see that and you see your pet eating grass, that can indicate that there is something gastrointestinal possibly going on. And your best bet is to get an appointment with your vet ASAP and get him or her checked out. All right. So hopefully that answers your question, Damien. Our next question comes to us from Kaden, who just visited us on Insta. All right. Kaden asks, hi, Dr. Carter. I heard that cats don't need dental care. I'm having a hard time believing it, but is it true? Hey, Kaden, that is a great question. And you are correct. Cats do need dental care. Okay. As far as dental disease in cats versus dogs, both is very prevalent. I will say this, that cats are a lot more sensitive to dental disease. So sometimes even the smallest amount of tartar or calculus can cause a severe reaction and can basically cause stomatitis, which is kind of inflammation of the oral cavity, the gums, even in the back of the mouth, which can be very painful. And it can obviously be very life altering because some of those cats that have such severe stomatitis, they have trouble eating, they're very painful, they're hypersalivating, things like that. I know people don't like to take their cat to the vet because cats are the ones that tend to get stressed out. But it is so important to bring your cats and your dogs in at least yearly for a quick checkup. Okay. That is the way you're going to be able to find out if there's any issues or problems, including dental or periodontal disease with your pet, by having your vet look at them. Now, sometimes you're going to notice things at home, but by the time you notice, problems with their mouth, sometimes it's really bad. Doesn't mean it's going to be life-threatening, but it means that you're going to need to have to take action now. And sometimes that could include like a dental cleaning with dental x-rays, possibly even extraction. And sometimes those things can get a little bit expensive. So it's better to have checkups done so you can try and kind of prevent from having some of these kind of major like dental emergency type things. But great question, Kaden. All right. This question comes to us from Helen, who reached out to us through YouTube. Hey, Dr. Joy, is it true that indoor pets don't need parasite prevention? I'm asking because we have a teeny tiny Brewer Terrier has been trained to use a potty pad and never goes outside unless he's in a stroller. Hi, Helen. All right. The Brewer Terriers, I love them. You don't really get to see them too often, but I have met a few and they're super cute and super sweet. All right. So, as far as it when it goes to parasite prevention, yes, 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 yes. You go outside. And even if your pet just goes outside in a stroller, or even if your pet is trained to use, potty pads, there still is a possibility of parasites getting into your home. Okay. There's a saying, I think it's what is an ounce of prevention is worth a pound of cure. It is a lot easier to prevent issues with parasites, okay, than it sometimes can be to treat them. I have seen hundreds of cases throughout my veterinary career of pets with tick-borne parasites, with fleas, with intestinal parasites that have unfortunately sometimes been life-threatening because they have gone untreated. Okay. Intestinal parasites, some of them can also be transferred to humans. It's not that common because most people, are pretty clean. And if they pick up feces, they wash their hands. But definitely there can be issues with, parasite transmission to younger children who don't realize they need to wash their hands and things like that, and then put everything in their mouth. Okay. That is just part of owning a pet, is making sure that you have them on preventative care. Just like you do things for your own health to prevent certain diseases and certain problems, you need to do that for your pet. Your pet can't advocate for themselves. The only people that can is myself as a veterinarian, and then as you. And parasite prevention these days is pretty inexpensive. And there are so many different companies, brands, types out there. You now have some new parasite prevention that lasts, I think, for up to a year. Okay. There are some that last for 3 months. And then there's a typical that you give monthly. There's pill form, there's chewable form, there is topical. So there's no excuse for anyone to not be able to put their pet on parasite prevention. Okay. A lot of times it does require having a yearly checkup with the veterinarian for him or her to prescribe it for your pet. But that is something that is very inexpensive. And trust me, I have seen so many pets who have had pretty significant issues and problems because of internal and external parasites that could have been prevented with just a pill that's maybe $20 to $30 a month. And then owners are spending several $100s for a blood transfusion on a dog that is so anemic because it is loaded with hookworms. All right. So yes, I know your baby doesn't go out that much, but you go outside, you can bring things in. And even just being with a stroller, there parasites have been around for a long time, guys. Like I think around since the dinosaur age. Okay. So these guys aren't going anywhere. I hate to say it. A lot of people like to do holistic and all natural things. These guys are beyond that. Okay. They are immune to that. I see people that say, oh, I put this on my grass to kill, or I put this on my pet to help with the fleas. And yet they still have fleas. These products are safe. Okay. There is always a possibility of any pet having a reaction to any medication. And that is the same thing with humans. But those reactions are very rare and few and far between. Knock on wood, I have not seen any life-threatening or major reactions to any of my patients that I have prescribed preventatives to. Okay. So if your pet is not on preventatives, go ahead and call your veterinarian today, schedule an appointment for a checkup, and then talk to them about what the best options are to get them on good prevention. Okay. All right. So we've got another question from our website. This is allhealthtv.com, and you guys should really go check it out. There is so much grateful information on there. And this question is going to come from Jasmine. Hi, Dr. C. So tell me if I'm wrong about this. The only foods that dogs can't eat are chocolate and grapes. Everything else should be okay. Jasmine, this is a really important question. Okay. I hope all dog lovers take notes with us. So yes, definitely grapes and chocolate are one of the two top human foods that can be toxic to pets. But that does not mean that everything else that we eat is safe for pets. There definitely are some human foods that are okay. And a lot of times us as veterinarians will recommend incorporating some of these human foods into your pet's diet. Things that typically I will recommend owners incorporate will sometimes be like plain chicken breast. Now, this is not like going to your supermarket and getting that rotisserie chicken with all the nice, juicy, greasy fat in the skin. Okay. This is just plain white chicken breast. Sometimes lean ground turkey meat is really good. Definitely white rice or sometimes even brown rice. I will sometimes have owners add in cottage cheese. Those are especially for my patients that may be having some stomach upset issues, and we need to kind of just feed them a bland diet for a time period. I will recommend feeding that. Certainly things like carrots, peas, even celery are not really that bad, but you do have to be careful with carrots because it obviously can be a choking hazard. And the same thing with celery. I recommend if you're giving any of that to your pet, you want to cut them into small pieces. I actually had a case of a dog who got a piece of celery, a stalk of celery stuck in its throat, and actually had to go in with a special scope and push it into the stomach. Obviously it's digestible, so that was great. We just had to push it in the stomach because this poor dog had to be anesthetized, and the owner had to spend quite a bit of money for us to do this because it was stuck in the throat. So if you are going to feed your pet human food and you have a question about it, listen, ask your veterinarian, okay? He or she is going to tell you whether it's a good idea or not a good idea. And if you have any question about it, just don't do it, all right? All of the dog foods, or I would say the majority of the dog foods that are out there today are nutritionally complete, okay? You don't need to be adding things else in there as far as human food. If you want to do some supplements and things like that, that's fine. But we don't really need to give human food to help with their nutrition. Okay. It's more of just like, oh, we're eating some food and I feel bad because my dog is begging and you want to give them. Some dogs are fine. They can literally get into the trash can and they can eat chicken wings and have no problem. And then I've seen other dogs that has happened to, and they've come into the hospital with basically severe bloody diarrhea to the point that they need a blood transfusion and had to be hospitalized for several days. And then several $1,000s later, thankfully they're going home well, but obviously with, their pet parents thinking, why the heck did I let them do that? Or, kind of thing. So better safe than sorry. There are some foods you can give them, but I typically tell owners if they have a question or they don't know how their pet is going to react to a human food, it's better to just stay away from it. So better safe than sorry, I say, Jasmine. All right, we got another Facebook question, and this one is from Paris. Hello, doctor. It seems like cats have a tendency to throw up, so this should be considered normal, right? All right, Paris, this is another question that reminds me of how important this episode is. So I will say this. A lot of cats do have a tendency to kind of throw up on a regular basis. And there does not mean there is anything else underlying going on with them. In particular, my cat at home, she loves to try and get into plastic. And I do try and keep it away from her. But if she chews on anything plastic that afternoon or the next day, she's going to barf it up. If I change the flavor of her food suddenly, even if it's the same brand of food, she will sometimes barf that up. So cats, do have a tendency to have a little bit more of a sensitive stomach or be more likely to vomit. A lot of times vomiting hairballs. We see that so much, especially with the cats with long hair or cats that are kind of excessive groomers. But also cats are predisposed to some gastrointestinal diseases, things like inflammatory bowel disease, and then something called GI lymphoma. And a lot of times those diseases can come on as very subtle signs at first, which could or could not be kind of intermittent vomiting. Certainly other signs that we can see would be decreased appetite, diarrhea, weight loss, just being kind of overall a little bit lethargic, just kind of acting weird. Cats are great at hiding disease. You do not know how many times I see cats rushed into the ER who are literally on their deathbed, and the owners are like, I swear he wasn't like this 2 days ago. Sometimes I believe them, sometimes I don't, but a lot of times, cats do that. They do not show signs that they are sick until it is like at a very critical point. So if you have a cat that is having vomiting, whether it's intermittent, once a week or here and there, and especially if they are older, take them to your veterinarian and let's just get a general health checkup. That probably is going to include maybe doing some blood work, maybe some radiographs, or some veterinarians might recommend an ultrasound, which is going to give us a lot more detail into the abdomen. Things like inflammatory bowel disease and GI lymphoma typically are diagnosed by ultrasound plus or minus with what we call like biopsies. It really depends on how far the owner wants to go. But a lot of times based on findings that we see on ultrasound, we can have a very high suspicion. All right. So don't get too freaked out. All right, Paris. But if your cat is having some vomiting, it's better safe than sorry to get, him or her checked out by your veterinarian. All right. The next one in the queue comes from Mitchell on our Instagram page. All right. Hey, Doc Joy. I was in a pet store yesterday and I saw that they carried a line of sunscreen for dogs. Come on, Doc. Dogs don't need sunscreen, do they? So, yes and no. Okay. If you are going to be having your pet out in the sun for a prolonged time period, there's nothing wrong with putting sunscreen on him. There definitely are several different types of skin cancer, and we do tend to see it more frequently in dogs who have not very thick hair or less hair, and dogs who also have basically white skin. All right. Melanoma is one thing we do see, and squamous cell carcinoma. And we even do see this in cats. Okay. Cats like to lay in front of the window. They like to bask in the sun and, do what cats do. And especially if you have one of those breeds of cats that does not have a whole lot of hair, they are certainly predisposed. Okay. So, if your pet fits that bill, then certainly if they're going to be outside for an extended time period, it's not going to hurt. Definitely recommend you can put some sunscreen on them, Mitchell. Okay. All right. This next question is from Haley, who just reached out to us through our YouTube page. Hi, Dr. Carter. I heard that it's healthier to let female dogs and cats have one litter before getting them spayed. Thoughts? Oh my God, Haley. So I hear this all the time, almost every day when I work. No, it is not necessarily healthier. Okay. So couple of things. Definitely, I am an advocate for spaying and neutering your pet. All right. Depending on the breed of your pet, sometimes we recommend to have that done a little bit later on, which could be after they are a year old, but they don't necessarily need to have a litter of puppies. Typically, your larger breed dogs, we are now starting to recommend to spay and neuter them a little bit later on once they're more kind of skeletally mature, okay, kind of full grown. As far as your smaller breed dogs, I still have no problem with it about 6 months of age, getting them spayed or neutered. And they do not need to have a litter of puppies. Okay. That is absolutely false. I hear it every single day and it's so frustrating. The good thing about when you do spay and neuter your pet, a couple of things that you can prevent is definitely like pyometra, which is an infection of the uterus that can be deadly. And then obviously mammary tumors. Pets can get mammary tumors, dogs and cats alike. So pets that are spayed at a more younger age are less likely to develop them. And the same thing with male dogs, okay? As they get older, they can get something called BPH, benign prostatic hypertrophy, that can cause them problems. They can get abscesses in the prostate. They can get tumors. They can get cancers, all that different stuff. If you have a question about when you should spay or neuter your pet, take them to your veterinarian and they will let you know the best time to do that. But yes, I definitely recommend every pet being spayed or neutered, and they do not necessarily need to have their first heat cycle, and they definitely do not need to have a litter of puppies. Okay. All right, guys. So this has been a great episode. I will say this. It's very frustrating as a veterinarian when a owner comes in and said, oh, I Googled this. Listen, there is a lot of good information out there online, but there is a lot of false information too. Okay. And so your best thing to do is if you have questions, ask your veterinarian. Okay. We are going to give you the best advice. I promise you, we are not here to mislead anybody. All right. So hopefully you guys enjoyed this episode, and I will see you guys next time. All right. Have a great day. Bye.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.